The role of democracy in health. The art of healthcare in India can be traced back to nearly 3,500 years. From the early days of Indian history, the Ayurvedic tradition of medicine has been practiced. During the rule of Emperor Ashoka, 3rd century BC, schools of learning in the healing arts were created. Many valuable herbs and medicinal combinations were discovered. Even today, many of those things continue to be used. According to our constitution, it is the primary duty of the government to provide healthcare facilities to all. Health is an important issue for people. However, healthcare in India is not available to all. While the constitution supports the view that the right to health is an aspect of our fundamental rights. In a democracy, people expect the government to work for their welfare. This could be through education, health, employment, housing, or the development of roads, electricity, etc. What is health? The saying goes, health is wealth. Healthy living is not a difficult thing. It is merely about making small changes in lifestyle, like adding fruits to your diet or having an extra glass of water each day. Diseases or illness can really mean a downturn in our lives, but regular medical checkups of family members can easily prevent serious medical problems and help us live a healthy life. We can think of health in many ways. Health means our ability to remain free from illness and injuries. But health is not only about diseases. Apart from diseases, we need to think of other factors that affect our health. For example, if people get clean drinking water or a pollution-free environment, they are likely to be healthy. On the other hand, if people do not get adequate food to eat or have to live in cramped conditions, they will be prone to diseases. Overall, health is achieved through a combination of physical, mental and social well-being, which together is commonly referred to as the health triangle. Healthcare in India. Healthcare in India features a universal healthcare system run by the states and territories of India. The Constitution charges every state with raising of the level of nutrition and the standard of living of its people and the improvement of public health as among its primary duties. The National Health Policy was endorsed by the Parliament in 1983 and updated in 2002. In order to prevent and treat illnesses, we need appropriate healthcare services such as health centers, hospitals, laboratories for testing, ambulance services, blood banks, etc. that can provide the required care and services that patients need. In order to run such facilities, we need health workers, nurses, qualified doctors, and other health professionals who can advise, diagnose, and treat patients. These facilities are required to take care of us. Government hospitals, some of which are among the best hospitals in India, provide treatment at taxpayers' expense. Most essential drugs are offered free of charge in these hospitals. Government hospitals provide treatment either free or at minimal charges. For example, an outpatient card at AIIMS, All India Institute of Medical Sciences, costs a one-time fee of ₹10 and thereafter, outpatient medical advice is free. In hospital, treatment costs depend on financial condition of the patient and facilities utilized by him but are usually much less than the private sector. For instance, a patient is waived treatment costs if he is below poverty line. Another patient may seek for an air-conditioned room if he is willing to pay extra for it. The charges for basic in-hospital treatment and investigations are much less compared to the private sector. The cost for these subsidies comes from annual allocations from the central and state governments. India has a large number of doctors, clinics and hospitals. The country also has considerable experience and knowledge in running a public healthcare system. There is a system of hospitals and health centers run by the government. It has the ability to look after the health of a large section of its population scattered over hundreds of thousands of villages. Our country has necessary infrastructure, knowledge, and people with experience, but it cannot make the necessary healthcare available to all. In this chapter, we will look at some of the reasons for this. Public and private healthcare services. We can roughly divide the various healthcare facilities in two categories: public health services, private health facilities. Public health services. The public health service is a chain of health centers and hospitals run by the government. They are linked together so that they cover both rural and urban areas and can also provide treatment to all kinds of problems, from common illnesses to special services. Primary healthcare is provided by city and district hospitals and rural primary health centers, PHCs. These hospitals provide treatment free of cost. At the village level, there are health centers where there is usually a nurse and a village health worker. They are trained in dealing with common illnesses and work under the supervision of doctors at the primary health centers, PHC. Such a center covers many villages in a rural area. Primary care is focused on immunization, prevention of malnutrition, pregnancy, childbirth, postnatal care, and treatment of common illnesses. Patients who receive specialized care or have complicated illnesses are referred to secondary, often located in district and taluk headquarters, and tertiary care hospitals, located in district and state headquarters. At the district level is the district hospital that also supervises all the health centers. Large cities have many government hospitals. Another important function of public health is to take action to prevent the spread of communicable diseases such as TB, malaria, jaundice, cholera, diarrhea, chikungunya, etc. This has to be done for all houses in the area. This has to be organized by the government with the participation of people, otherwise it is not effective. For example, taking up a campaign to see that mosquitoes do not breed in water coolers, rooftops, etc. This has to be done for all houses in the area. According to our constitution, it is the primary duty of the government to provide healthcare facilities to all. The government must safeguard the right to life of every person. The Supreme Court said that it was the duty of the government to provide the necessary health services, including treatment in emergency situations. Hospitals and medical staff must fulfill their duty for providing the necessary treatment. In recent times, India has eradicated mass famines. However, the country still suffers from high level of malnutrition and diseases, especially in rural areas. Water supply and sanitation in India is also a major issue in the country, and many Indians in rural areas lack access to proper sanitation facilities and safe drinking water. However, at the same time, India's healthcare system also includes entities that meet or exceed international quality standards. The medical tourism business in India has been growing in recent years, and as such, India is a popular destination for medical tourists who receive effective medical treatment at lower costs than in developed countries. Private health facilities. There is a wide range of private health facilities that exist in our country. A large number of doctors run their own private clinics. In the rural areas, one finds registered medical practitioners, RMPs. Urban areas have large number of doctors, many of them providing specialized services. There are hospitals and nursing homes that are privately owned. There are many laboratories that do tests and offer special facilities such as X-ray, ultrasound, etc. As the name suggests, private health facilities are not owned or controlled by the government. Unlike the public health services, in private facilities, patients have to pay a lot of money for every service that they use. Today, the presence of private facilities can be seen all around. In fact, now there are large companies that run hospitals, and some are engaged in manufacturing and selling medicines. Medical shops are found in every corner of the country. Traditional practices of healthcare. Traditional practices of healthcare. Indigenous or traditional medical practitioners continue to practice throughout the country. The two main forms of traditional medicine practiced are the Ayurvedic system, which deals with mental and spiritual as well as physical well-being, and the Unani or Galenic herbal medical practice. A Vaidya is a practitioner of the Ayurvedic tradition, and a Hakim is a practitioner of the Unani or Greek tradition. These professions are frequently hereditary. A variety of institutions offer training in indigenous medical practice. Only in the late 1970s did official health policy refer to any form of integration between allopathy-trained medical personnel and indigenous medical practitioners. In the early 1990s, there were 98 Ayurvedic colleges and 17 Unani colleges operating in both the governmental and non-governmental sectors. Central government's role. Critics say that the national policy lacks specific measures to achieve broad stated goals. Particular problems include the failure to integrate health services with wider economic and social development, the lack of nutritional support and sanitation, and the poor participatory involvement at the local level. The efforts of the central government at influencing public health have focused on the 5-year plans, on coordinated planning with the states, and on sponsoring major health programs. Government expenditures are jointly shared by the central and state governments. The goals and strategies are set through central-state government consultations of the Central Council of Health and Family Welfare. The efforts of the central government are administered by the Ministry of Health and Family Welfare, which provides both administrative and technical services and manages medical education, while states provide public services and health education. The 1983 National Health Policy was committed to providing health services to all by 2000. In 1983, healthcare expenditures varied greatly among the states and union territories, from Rs 13 per capita in Bihar to Rs 60 per capita in Himachal Pradesh. And India's per capita expenditure was low when compared with other Asian countries outside of South Asia. Although government healthcare spending progressively grew throughout the 1980s, such spending as a percentage of the gross national product (GNP) remained fairly constant. In the meantime, healthcare spending as a share of the total government spending decreased. During the same period, private sector spending on healthcare was about 1.5 times as much as government spending. Medical tourism in India. India is quickly becoming a hub for medical tourists seeking quality healthcare at an affordable cost. Nearly 450,000 foreigners sought medical treatment in India last year, with Singapore not too far behind and Thailand in the lead with over 1 million medical tourists. In order to attract foreign patients, many Indian hospitals are promoting their international quality of healthcare delivery by turning to international accreditation agencies to standardize their protocols and obtain the required approvals on safety and quality of care. Healthcare and equality. India has 137,000 sub-centers, 28,000 dispensaries, 23,000 PHCs, 3,000 CHCs, community healthcare center, and about 12,000 secondary and tertiary hospitals. The whole administrative setup may appear large, but most of the healthcare facilities are understaffed, and understaffing is most prominent in the rural healthcare sector. 15% of Indian population do not have access to healthcare due to reasons of unavailability or due to economic reasons. Expansion of healthcare in India has been mostly urban-oriented, when major part of population lives in rural or semi-urban locations. Mushrooming of private hospitals in India has been in the urban areas and is profit-oriented. Public healthcare systems are becoming extinct by the day. Insurance system may not suit Indian conditions, since a very large section of rural population would not be able to afford it, and the governments, central or state, may not find the required budget. In India, we face a situation where private services are increasing, but public services are not. Many people cannot afford them or have to borrow money when there is an illness in the family. For those who are poor, every illness in the family is a cause of great anxiety and distress. Sometimes it is not only the lack of money that prevents people from getting proper medical treatment. Women, for example, are not taken to a doctor in a prompt manner. Their health concerns are considered to be less important than the health of men in the family. Many tribal areas have few health centers and they do not run properly. Even private health services are not available. A pregnant woman has to travel many kilometers to see a qualified doctor. Health insurance. The majority of the Indian population is unable to access high-quality healthcare provided by private hospitals as a result of high costs. Many are now looking towards insurance companies for providing alternative financing options so that they too may seek better quality health care. The opportunity remains huge for insurance providers entering into the Indian healthcare market, since 75% of expenditure on healthcare in India is still being met by out-of-pocket consumers. The Insurance Regulatory and Development Authority (IRDA) is the governing body responsible for promoting insurance business and introducing insurance regulations in India. Causes of health issues. Disease. India suffers from high level of diseases, including malaria and tuberculosis. It is striking to note that 1/3 of the world's tuberculosis cases are in India. Ongoing program of the Government of India about HIV has led to the decrease in the spread of HIV in recent cases. Pollution. According to the World Health Organization, 9 lakh Indians die each year from drinking contaminated water and breathing in polluted air. As India grapples with these basic issues, new challenges are emerging. For example, there is a rise in chronic adult diseases such as cardiovascular illnesses and diabetes as a consequence of changing lifestyles. Malnutrition. Half of children in India are underweight, one of the highest rates in the world, and nearly the same as sub-Saharan Africa. India contributes to about 5.6 million child deaths every year, more than half of the world's total. Water and sanitation. Water supply and sanitation in India is a matter of concern. As of 2003, it was estimated that only 30% of India's wastewater was being treated, with the remainder flowing into rivers or groundwater. The lack of toilet facilities in many areas also presents a major health risk. Open defecation is widespread even in urban areas of India, and it was estimated in 2002 by the World Health Organization that around 7 lakh Indians die each year from diarrhea. No city in India has full-day water supply. Most cities supply water only few hours a day. In towns and rural areas, the situation is even worse. What can be done? There is little doubt that the health situation of most people in our country is not good. It is the responsibility of the government to provide quality healthcare services to all of its citizens, especially the poor and the disadvantaged. However, health is as much dependent on basic amenities and social conditions of the people as it is on healthcare services. Hence, it is important to work on both in order to improve the health situation of our people. The CSDH, Commission on Social Determinants of Health, recommendations are based on 3 principles for action. First, health inequalities are associated with social inequalities, which improve the conditions of daily life, the circumstances in which people are born, grow, live, work, and become old. tackle the inequitable distribution of power, money, and resources, the structural drivers of those conditions of daily life, globally, nationally, and locally, as well as measure the problem, evaluate action, expand the knowledge base, develop a workforce that is trained in the social determinants of health, and raise public awareness about the social determinants of health. Thirdly, action needs to be taken at global, national, and local levels. The national policy for environment needs to empower grassroots community participation in identifying what needs to be done, in developing interventions and programs, and in evaluating their effects. Health workers at the heart of communities have a pivotal role to play in raising awareness and calling for action on social determinants, and in the process of developing and evaluating action at local and national levels.